My name's Richard, and I have been diagnosed with atypical facial pain. This condition is extremely painful, and it affects the nerves in my face and head. Most people don't know about it. I didn't know about it until I developed it, but it actually affects a lot of people. The atypical means that it doesn't follow a necessary pattern. It's not one nerve or one area. It kind of changes, it moves, and affects multiple nerves. In my case, the nerves that it affects are focused around my left eye. They go down into my jaw sometimes. They usually stop at the joint. Sometimes it does go further down, but it also goes all the way up, back to my bald spot, around and above my ear and back around this whole area of my head. Depending on the severity of the day, it could affect center just around my eye, maybe inside of my nose and my cheek, part of my cheek, to a bad day when it's pretty much 1/3 of my head is being affected by this pain. I want to make this video to describe what I've been through over the last almost 5 months since this pain has developed. I'm not making this video for sympathy. I'm making this video more as an educational experience. There's a lot of people that have this, that are new to it, like I was. There's friends, there's families that don't know what this condition is, how it affects people, or what it feels like. I want to make this video to explain what I've learned and what I've been through in dealing with this kind of nerve pain. Before I get into my entire experience, I want to talk a little more about it. There's different reasons people develop this pain. If somebody has a car accident and they've had serious trauma to their face, it's very easy to develop this nerve pain. But it's also, I would say, expected because they had a physical trauma. In my experience, I just woke up with this one morning. And it actually seems to be a very common thing. Many of the people I've talked to say that they just wake up and they have this pain. And there's no real reason why they have it. I've also learned that it affects everybody, everywhere, of every age. I've been doing a lot of reading, a lot of watching videos. I'm in several Facebook groups talking to other people, trying to learn what they're going through, what I'm going through, how we can relate to each other, how we can help each other. And what I've learned is it affects men and women. It affects the young, it affects older, it affects people all over the world. Anywhere could have this experience. And many times medication can take care of it. In my case, medication was not enough, and I actually had a few procedures done to get me to the point I'm at today. And there are much more invasive surgeries if I need in the future that can be done to try to alleviate this pain. Most common statistic that I've found is 1 in 1,000 women develop this kind of pain in their face, and 1 in 2,000 men. So women are twice as likely to develop this sort of nerve pain. I call this an uncommonly common condition. From talking to all the different doctors that I dealt with over the course of 5 months, and I saw a lot of doctors and surgeons, many of them say that one of the causes of this pain is obviously trauma, but another cause could be a virus, because viruses like to attack your nervous system. I don't know if I had a virus or not. I wasn't sick before this pain started, but this is in 2021 when we have Corona's the big virus in the news, but there's also other viruses always going around. That one of my doctors even suggested maybe I had some sort of reaction to something that's going around, and that's what caused this. I also had chickenpox when I was a child, so that means I have the shingles virus in me. Shingles causes major nerve pain and nerve damage, but it usually is accommodated by a rash. I never had a rash, but I have my suspicions that this is possibly caused by shingles that have developed in me over time. And I may have been misdiagnosed or underdiagnosed for that. It was never tested, but at this point, it's managing my pain levels. That's all I can do from now on, is manage my pain levels. And I learned a little bit about shingles through all this. Every doctor will say you have to have a rash along with the shingles. You may have a rash first, then the pain. You may have the pain, and then later on develop a rash. After going to the doctors I've gone to, the specialists, talking to other people that had shingles, talking to other people with these types of pain, you do not have to have a rash to go along with the shingles pain. Many people call it internal shingles. So you have severe pain with no outside symptoms. I argued with several doctors to check for it. They wouldn't do it. By the time I got to the specialist who said, yes, you don't have to have the rash, it was pretty much too late. If I did have shingles, the damage was done, and I just have to deal with the pain. All right, so at this point, I'm going to get started explaining what I've been through over the last 5 months. As I said earlier, I've been dealing with this for about 5 months now. In that 5 months, I was partially in a blur, in a fog. There's many days, many weeks I just have no memory of because of medication. So I'm trying to tell my story as in the most chronological order that I can remember. And I've been making lots of notes. I got 2 pages here worth to go over. If something's out of order, doesn't seem like it makes sense, I'm sorry. It's some of the stuff I don't remember because of the medications I was on at the time. So just try to hold on, follow along with me best you can, and I'll try to make this as easy as possible. So August 15th, 2021 was a Sunday. It was a normal Sunday for me and my family, did the normal things we do. Sunday night, got ready for work on Monday, and went to bed. Nothing out of the ordinary. August 16th, 2021, I woke up sometime between 3 and 4 in the morning, and I just had this horrible pain around my left eye, my forehead, and the side kind of around to the temple area. So I got up and I turned the lights on, and immediately I felt like somebody stabbed me in the eye. For some reason, I was extremely light sensitive, and it didn't take much light, and I couldn't handle it. I had to just either sit and cover my eye, which I spent many weeks and months doing, or I had to just sit in a dark room, or I'm walking around with one eye closed just to stop the pain from the light entering my eye. But my vision was perfectly clear. I was confused by that. Usually when something hurts, you'd have blurry vision for some reason. Anyways, I got up and I tried taking like some Tylenol, and it didn't seem to make any difference, and the pain was just getting worse. And I've had headaches like everybody else has, but this was much more intense than I'd ever felt before. And I've never had a migraine, so I didn't really know what a migraine felt like, so I thought this must be what a migraine felt like. It just, every heartbeat, you could feel just every pounding, you could feel, and it felt like needles in my head, and it just felt like my eye was being pushed out of the socket, and on top of the light sensitivity. And I got up and I took something, and I was like massaging it and just trying to relax it because I wanted to go back to bed because this is early in the morning. Just trying to make it better because I had to go to work. It eventually got to the point when I decided I need to go into the ER and find out what's going on. By this point, the kids were up, my wife's up. Um, she had to go to work. She had to drop the kids off at school. So I said, I'll call my mom. She can take me to the ER. So we get to the ER, and I'm explaining the pain to him. And the doctor seemed a little concerned. Usually ER doctors are pretty calm and cool because they see a lot of stuff. And he said, you know what? We need to do a CT. Okay, so they took me in, did CT, come back, and I'm just in pain. I actually had my sunglasses on, and they turned the lights down in the room, and I still either had to close my eye, cover my eye, something was still affecting it. And they gave me some medicines and didn't really do anything. And the doctor finally said, well, we're going to give you some morphine to cut the pain. I've had morphine other times from surgeries and ER visits and things. Normally when I get morphine, it doesn't take much and it just knocks me out. So I was kind of looking forward to this because it hurt and I was tired and I wanted to take a nap. So I told the doctor, though, you got questions, you better ask me before you give me the morphine because morphine just knocks me out. So I get back from the CT, they give me the morphine, and I'm sitting there waiting for it to kick in, and nothing's happening. And then they also gave me some other things so I wouldn't have an upset stomach from the morphine, things like that. And I'm sitting there waiting, I'm wide awake and just hurting. So the doctor comes in, sits down, and he says, well, the good news is there's no tumors. So apparently the doctor was worried that I had some kind of growth or something, and it's probably because I said I felt like my eye was being pushed out, which I learned later on is a very common pain for people who have this nerve issue. He said, what I have is trigeminal neuralgia, cluster headaches, and migraine. At that time, I had never heard of cluster headaches and I never heard of the trigeminal neuralgia. But that's what he told me I had, so okay, that's what I got. And he said, well, this could take a few days, maybe a week. If it's a migraine, to go away. They're going to give me some prescriptions and they're going to send me home. He said I need to go see my family doctor and go get an MRI. But he never gave me any orders for an MRI. He just said, go get one. He said, well, we're going to discharge you and we're going to give you another dose of morphine. So I was like, okay, well, maybe the second dose will kick in and I'll feel better, or maybe I'll get some sleep. So they gave me another dose of morphine. They gave me all my paperwork. They discharged me and let me leave. The second dose of morphine didn't seem to even do anything, which was still strange to me because, like I said, normally morphine just knocks me out, no problem. So they sent me home. That was it. Later in the day, I called my family doctor and got an appointment with him. So luckily I was able to get in like 2 days later. So I go see my family doctor and he looks through the ER record and we're talking about different things, and he said, well, it's most likely a migraine. Could be from a number of things, from stress from some reason up to maybe I had some sort of virus or something and didn't even know it. Just, anything could have caused it. And he said he wants me to get an MRI and he's going to give me a few different prescriptions. And since I was having pain in my left eye and centered around the left eye, like the whole socket hurt, it was even hurting down the inside of my nose and just kind of the whole area. He wanted me to go see an eye specialist. So I'm like, well, I'm fine with that. Any doctor is going to make it feel better and get rid of the pain, because I was also concerned about my eye since it was centered around my eye, because vision can be very tricky and you definitely don't want to lose it. So he gave me a referral to an eye specialist, not just an eye doctor. It's an eye specialist who does like surgeries and things on eyes, not just gives you classes, checks your prescription. So it was 2 days later that I was able to get in to that doctor. Surprisingly, I could get right in. So I go to this doctor, and he does all kinds of tests on my eye, dilates my eye, checks it, and he says, there's nothing wrong with my eye, the eyeball itself. He said it's very healthy. There's no scratches. There's no foreign bodies in it. There's no bleeding inside the eye. There's no pressure in the fluid inside my eye. He can't find any damage to my eye at all. So he said, you need an MRI. This is the third time I've heard that. To see what's going on. It must be something else behind the eye, either a muscle or nerve that you can't see when you examine an eye. It's something behind it or inside somewhere else. But he actually gave me an order to get an MRI. It took 3 doctors to get one order to get an MRI done. So I had the MRI scheduled for the following Thursday, maybe Friday. I can't remember exact dates, to get the MRI done and see if we can find out what's going on that a CT couldn't show and is affecting me somehow. Because the doctor was even a little, the eye doctor was even a little surprised that with the pain I was having, that there was no visible reason, and I had, with my glasses, 20/20 vision. He said that's fairly unusual. He had heard of the trigeminal neuralgia, but he wasn't convinced that that's what it was. So that was the end of that visit. That was a Friday. So now I had a bunch of medications to try to make it through the weekend and see what happens if the pain would go down. A couple of doctors said, well, it just might go away on its own. If it's a virus or something, if my body clears out the virus, maybe this pain will just go away. If it's a migraine, it should just go away. It's been 5 months and it hasn't gone away. And there's a very, very little chance in my life that this will go away. It's probably something I'll deal with for the rest of my life. So over the weekend, I sat around with my sunglasses on, inside the house with the curtains pulled, not really doing much. The medications kind of made me tired. I just kind of sat around, watched TV, didn't really do a whole lot. I just couldn't do anything with the pain. I couldn't get up and do much because my balance was off, things like that. So I took it easy over the weekend. August 24th of 2021, which was 8 days after my first ER visit. It was a Tuesday. So these meds aren't helping. I've still got the severe pain. It's not getting any better. Something more needs to be done. So at this point, it's a Tuesday. My wife was at work, kids were at school. I called my mom and said, take me to the ER, because I can't get into my family doctor. I can't get into anybody else for several days or to several weeks. Everybody's always booked. So she took me to ER. I was telling that doctor about what was going on. He looked at the ER record from before, and he said, well, this might just go away. It just seemed like he just wanted to push me off, get me out, didn't really care, honestly. And I kept saying, there's something going on. This can't be a migraine. It's just such a severe pain. It just felt like it was down, clear into my jaw, and if you ever had your jaw lock up and you're kind of moving your jaw around to make it pop, it felt like that in the jaw. It was down into my teeth, the roof of my mouth, my nose, even like inside my nose, just the left half of my face, and it was starting to work its way up over the top. What a lot of people don't know is the nerves in your face are split right down the center, all the way to the top, all the way down the center of your face. They come from each side or inside, and they take care of the left half or the right half. And I didn't know that at the time because I was worried that this would jump to the right, and the doctor was explaining, no, that's not how the nerves work. I said, but this isn't getting any better. I need something to fix this. something to stop the pain. And he said, well, you've already had a CT, you need an MRI. I know, I've got one scheduled. It's later in the week. I couldn't get anything any earlier. And he said, well, if this is trigeminal, they'll find it in the MRI. Okay, so I've just got to wait a week. I said, but can you give me something different? I told him all the meds I was on at the time. I said, I'm almost out of them, and they're not really doing anything. I'm still extremely light sensitive. I'm still in pain. Can you give me something else? So he gave me Norco, which is a strong painkiller. I said, okay, we'll go get these. Hopefully that'll work. We'll find out in the MRI what's going on so I can get over this. That was the first ER visit that day. So they discharged me, and my mom took me from the hospital to the pharmacy. Is about 15 minutes. We went and picked up these prescriptions. While I was at the pharmacy, this is when the worst day of my life started. I should say the most painful day of my life had started. So I go to the pharmacy and tell them, hey, doctor called in, a couple of prescriptions. And of course they weren't ready because it'd only been, 15, 20 minutes since we left the hospital. So I sit down, just wait there at the pharmacy. And I'm not feeling good. I felt fine. I don't know. As fine as I could feel with this pain in my head. I mean, that was it. My head hurt. Nothing else was bothering me. But while I was sitting there waiting on the pharmacist to fill my prescriptions, all of a sudden something's not feeling right. And they called me and said, okay, my prescription's ready. So I got up and I'm standing there and the lady's talking to me and I'm half listening, and she even said one time, are you okay? And I'm like, yeah, I'm fine, just I need the prescriptions. I'll take those and I'll be fine. I got somebody that's driving me. So I said, I need my prescriptions and I'll go out to the car and they'll take me home. And it's kind of getting dizzy. All of a sudden I'm super hot and this pain is just pounding and it's getting worse. I don't know what the hell is going on. So I grab the bag and I stumble out to the car and I get in and I just lay the seat down because I'm thinking maybe if I kind of lay back and try to relax, whatever's going on will ease up a little bit. And my mom even looked at me and goes, she's like, what's wrong? And I'm like, I don't know. I just want to go home, take these meds, and try to feel better. From the pharmacy to my house is maybe a 5-minute drive. In that 5 minutes, I went from I don't feel good to I started screaming, I started crying, and all I could do was just pound on the seat just because I had this intense pain at the time I couldn't even describe, and just it came on that quick. My whole, from pretty much maybe where the middle of my mouth is, all the way up, across my nose, my eye, all the way up back to the bald spot area where those nerves end, just was intensely killing me. And in that 5 minutes from I don't feel good to all I could do was scream and cry. And I'm laying in the seat just screaming and just crying. And all I could say was, make it stop, just kill me. Somebody just kill me. This hurts so much. Just make it stop. Just pull the nerves out. Do whatever. Just shoot me, kill me, just do something, make it stop. Just all I could do was scream and cry and just pound on the seat and just scream. I wasn't even trying to scream. It just, my body was doing it. And I couldn't do anything. I couldn't see anything. I just cried so hard. I've never cried that hard in my life. I never screamed from pain that hard in my life. That I just couldn't do anything. I was just curling up on the seat, and everything in my body was starting to hurt, and it just was so intense. And I know I was scaring my mom, and and she's starting to cry while she's driving, and all I could think was just go home, just go home. Oh my God, just kill me. It just hurts so much. Just make it stop. Just make it stop. And we pulled into the driveway, and my wife and my daughter happened to be outside grilling supper when we got there. And mom jumps out of the car and runs over and grabs my wife, and my wife and my daughter come over, and they open the car door, and I'm just laying there screaming and crying and I just couldn't do anything. And I said, just give me one of the Norcos. Give me a Norco. I'm thinking maybe the painkiller will stop whatever this is. So she runs in, she grabs a bottle of water, and she gives me one of the Norcos, and I take that. And now I know it takes 20 to 30 minutes when you take an oral medication to even begin to work. My brain knows this, but just the intensity and the way I was screaming, and all I could do was say, just kill me. Oh my God, I want to die. Just kill me. Rip these nerves out of my head. Do whatever you gotta do. Just make the pain stop. I can't handle this. Just kill me. Just kill me. Just kill me. That's all I could say was, I just wanted to die because this hurt so much, so intensely. And my wife and my daughter and my mom are standing there, and they're all three crying because they don't know what to do. And I told my wife, just get in the car and take me back to the hospital. So she jumps in, and from my house to the hospital should have been a 15-minute drive. I think she did it in about 8. The whole way I'm just screaming. It was so intense. I'm crying. By this time, my shirt is wet because I'm crying. I'm sweating. I'm hot. I'm screaming, and I'm just pounding on the seat, and I almost couldn't control myself. I'm just curled up in the seat screaming. And I'm sure you could have heard me outside the car several feet away. I've never screamed so loud, and I never had so much pain. And I'm telling her, just kill me. Just throw me out and kill me right now, right? Just kill me. I just want to die. Just make this pain stop. Make this pain stop. Make this pain stop. And we finally get to the hospital. And we pull up in front of the ER. And she runs in. She gets the receptionist, first person that you see. And she comes out, my wife's there, and the receptionist is like, well, can you get out of the car? And I'm just laying there screaming, and I'm like, no, I can't do anything. I'm curling up in this little ball. I'm just screaming. I'm just crying. Oh my God, it hurts so bad. I'm still saying, just kill me. Just kill me. This hurts so bad. I just want to die. So she runs back inside. She grabs a wheelchair, and she grabs one of the nurses. So they come back out, and the nurse asked me, he's like, hey, hey buddy, can you stand up? Can you get out? And I'm like, no, and I'm just screaming at the top of my lungs and crying harder than I've ever cried before for any reason. And it took all three of them to get me out of the car and kind of into the wheelchair. And they wheel me in, and of course you can't just go straight back into the ER. They got to stop and do their thing first. And I'm in the lobby just screaming. And I'm still got my eyes closed. I can't open my eyes. I'm just screaming, and I'm yelling, just kill me. Somebody just kill me. Oh my God, this just hurts so bad. Just kill me. And so they took me in, and they're like, hey, can you get up on the bed? And I'm still just screaming and crying, and they finally picked me up and put me in the bed, I guess. I don't remember getting in the bed. And all I could say was, just kill me. Just get this out of my head. Get these nerves out of my head. Cut them out of my head. Cut me open. Just rip them out. And the nurse is like, what do you need out of your head? And I'm like, just get it out of my head. Just get this pain out of my head. And he's like, well, you need to tell us what you gotta get out of your head. And in the back of my mind, it dawned on me that, oh my God, he thinks I'm on something, I'm a junkie, or I'm high on something, I'm coming down off something. Because I worked in a hospital for a few years. I saw people come in that were on medications or on drugs or coming off of them, and realized that I was kind of acting and sounding like they were. And he told me if I keep telling them that I just want somebody to kill me, they're going to take me to psych ward. And I remember saying, I don't care, just make the pain stop. Just make this pain go away. Make it stop. And I still had the bracelet on from earlier in the day when I was there. And actually, from the time I was discharged, got my meds, went home, and had been brought back was less than an hour. I went from when I was discharged to I'm hurting, but I'm fine, to less than an hour later, I'm asking for everybody, to kill me. The nurse is trying to figure out what's going on. The doctor wants to know what's going on because all he knows is they brought a screaming patient in. And I'm just saying, get these nerves out of it. Just cut the nerves out of my head. Just get these nerves out of my head. And the thing is, there's nothing on the outside of my face. There's no indication that there's anything going on. I had no bruises, no cuts, no anything that somebody could look at and say, oh, I can tell you're hurt. There was nothing on my skin. It was all inside. It was all just the nerves. I understand now, looking back, that the nurse sees this kind of stuff. The fact that I had no external symptoms. He questions things, and I get it. Looking back, I get it. He was doing his job. What changed everybody's mind is I heard my wife somewhere in the room, because my eyes are closed and I'm screaming, it's echoing, and I couldn't really tell what was going on, but I heard my wife in the background say, he was just here, and they say he has trigeminal neuralgia. And I kind of tried to hold my hand up because I had the bracelet on, and I don't know if I did or not. I think I did. And you could almost feel the room change. The whole attitude in the room changed. And I remember the nurse went from, what do we need to get out of your head, kind of questioning, to, I'll be right back. I'm going to get an IV to get started. So at least when my wife told them what was going on, they realized I needed help. I needed something. I was in this extremely severe pain that was making me scream, that the whole floor could hear me, why I was crying so hard, and why I was asking to rip the nerves out of my head just to do anything to make this pain stop, and why I wanted to die. They've seen this before. So I remember him saying he's going to get an IV, and he came back into the room, and he goes, okay, I got to get this IV started. And I remember reaching over and grabbing the railing on the bed, and in my head, I was crushing the rail. That's how I felt. I swear if I opened my eyes and looked at the railing, I was squeezing it so hard that I had to have put fingerprints in it. Obviously, I'm not that strong, but just the emotions and intensity of all of this, I just felt like I was crushing that rail, and I was putting my arm out there so he could get an IV in. I don't even remember him putting the IV in. I just remember him saying he's coming in with one. I reach over just to try to help, thinking if I just get my arm out there, let him stab me anywhere to get it in, start putting something in me. And the next thing I felt was the cold, where they actually had the IV in. I didn't even feel him stab me. I didn't feel him put that band around your arm like they do. I don't know if he needed it as tight as my arm was. And I felt the cold going into my arm from the IV saline solution that they were first pumping in. And I remember the doctor saying he's going to order some medications immediately to start giving me to calm me down and get this pain lowered. So I stopped screaming and I stopped crying. And I remember hearing this going on while my body is just controlling itself, screaming, crying, pounding on the bed with my other arm because I just wanted to get that energy out. Anybody that's gotten hurt knows what that feels like, where you just hit something and try to get that energy out. All I could think was, I do this now. Give me something now. I don't care what you give me. I don't care if it kills me, just as long as the pain stops, that intensity. I don't know if it was 2 minutes, 20 minutes, an hour before they got back with the medication. I had no idea, no concept of time at that point. All I remember is I'm screaming, I'm crying. And then the next thing I know, I'm sitting up in bed. My head still hurts, but I'm not screaming anymore. I feel really funny, like I'm just kind of floating. And I had no idea what had happened. I found out later on, because I asked my wife, what happened? I'm losing, I missed some time. I lost this time. Just, it's a black time in my mind. And she said, they gave me a whole bunch of medications through the IV that knocked me out. And at least it stopped the screaming, which my throat was hurting at this point because I'd been screaming for over an hour. She said, they gave me these meds and it didn't take too long. I went to sleep. But I wasn't supposed to be sleeping because of the meds they gave me. They set me up in the bed and set the bed up in a reclined position. And she said the heart monitor would start to beep if my heart rate got too low. So the nurse would come in and be like, hey buddy, you gotta wake up, sit up, you gotta wake up. My heart rate would go back up. And then, they'd leave and I'd start to go to sleep again. And my wife would talk to me and kind of wake me up. My heart rate would go back up. I guess this went on for a couple hours. I have absolutely no memory of it. When I remember waking up, being conscious again, the doctor came in and was saying he believes I have the trigeminal neuralgia. It's not a migraine. It's not cluster headaches, although that could be part of it, but that's not the cause. I have trigeminal neuralgia. And he says it does create these intense pains. The only thing that he's ever known is you can take medication to try to reduce the pain and have surgery. That was my only options that he really knew about. We talked about a few things, which now I remember talking about. I don't remember what it was because I'm still high on whatever they gave me at the time. All I could think of is, well, my life is over. That's it. I'm basically going to be in pain, be a vegetable the rest of my life. It's not true. It just took a while to get past that. So they gave me some meds. They gave me enough to get through the night because by now it's like 11 o'clock at night. The next day, I think my mom went and got my prescriptions because my wife had to go to work, and the kids were at school or something like that. I honestly don't remember much. So the ER doctor gave me 2 prescriptions. One of them is called Trileptal. That's the brand name. I can't pronounce the generic name. Most of these medications, I can't pronounce the generic names. I will put all these medications that I was on in the description. I'll put the name that I can pronounce, the brand name. I'll put the generic name, and I'll even put the dosage I was on and what it was for. I'll do all that in the description so you can read it and not have to listen to me destroy the names. So I was put on Trileptal and gabapentin. I've been dealing with IBSD for over 20 years, and I also had my appendix out several years ago, and because of having my appendix out, I ended up with some scar tissue that traps the nerves and creates pain. So I've been on gabapentin for several years before this. So I knew that medication when he said it, and my wife knew that one when he said it. But I was on 100 to 300 milligrams a day, daily for, the last several years. He said what I need to get up to is, I think he said 1,600 milligrams. And the trileptal, I need to get up to about 1,800 milligrams. When I was home and I had my prescriptions, and they told me when I left the hospital, on the trileptals, they have what they call the 3-day rule. What you're supposed to do is take one more pill every 3 days. So he said start out taking 2, and 3 days later take a third one, and 3 days later take a fourth one. I ended up getting up to 6 pills, 6 300 milligram pills a day. After having this worst pain ever, I've been trying to figure out how do you describe it to people that have never dealt with it, never had it, never seen somebody have it like, my family did. I talked to a lot of people in a Facebook group for trigeminal and facial pain and asked them, how do you describe it, what their feeling was, and I came up with the best way I can think of describing it for this video. I hope everybody that's watching this understands, and if you ever know somebody that goes through this or has part of it, that we're not making it up. It really does hurt that much, even though in my case where it's on this left side, there's nothing there on the skin. There's no rash, there's no burns, there's no cuts, there's no bruises, anything. It's all internal. It is extremely intense. So the only way I can think to explain it is to show you a few things and tell you that that's what it felt like inside of me. First thing, let me get this up here. This is nothing but a drywall screw, 2.5-inch drywall screw. Imagine having hundreds of these slowly being drilled into your head, around my eye, my nose, down in here, into my jaw, and just the whole top of my head. Just imagine hundreds of these slowly being screwed in at the same time. On top of that, with every heartbeat, you not only have these screws going in, but imagine somebody beating those screws with this hammer. This is a 3-pound small sledgehammer. Just imagine they're beating you every heartbeat. Those screws are slowly drilling in, and at the same time, they're being driven into your head. It just, every heartbeat, nonstop. Not only do you feel that kind of pain, but it also is burning. And I don't mean just like, oh, it's a little warm. I don't know if anybody's ever seen one of these torches. But you see that blue flame? Imagine having that blue flame on your skin, or in your skin, everywhere. You can't do anything about that. That's an intense burning. And it just is non-stop all the time, on top of the hammering, on top of the screws, on top of everything else. And if that wasn't enough, since your nerves are electrical, the electrical part of your body, not only are they burning, they're on fire, they're being hit, but they also feel like they're shorting out. And the only way I could really think of describing it is if anybody's ever seen a taser. Just imagine that. But that's going on inside of your skin. You can't see it, but that's what it feels like. It's just your nerves are shorting out to each other. They're just on fire. They're being hammered. Just all of that at once. Just imagine for hours and hours and hours and hours until you get enough medication to lower that. And if now, on top of all those things that are causing pain, I got a little video clip here if you don't know what a vacuum sealer is. take all of that pain that's inside those nerves, and for me it's on this left side of my head, and imagine your skin is being sucked down, or it vacuum sealed. Imagine your skin is that bag vacuum sealing onto your skull. That's what it feels like. Some people I talked to said it felt like their head was in a vice, that pressure of being crushed. Other people had other ways of describing it, but vacuum sealing is what it reminded me of, that the skin is being sucked down and compressed against your skull. To where I'm at now, I don't have as much pain. And after I got on the trileptal and got up to a level where you could somewhat handle the pain, I didn't have that electrocution feeling as much, but I would get what I call bee stings. You might be just sitting there watching TV, and all of a sudden, right in the corner of my eye, I felt like I got stung by a bee or a wasp, and the whole inside of my nose would just hurt. Or you'd get one over here, or somewhere in this area, and it would send shocks through you, and then your eye starts to water because it hurts, or when you get this one on the inside of your nose, sometimes both my eyes would water because that shock felt like somebody punched you in the nose. Sometimes you'd get a shock, down here in your jaw or something. You get a kind of, move your jaw around, it would help. Or up here, felt like you get stings. So those were still there even on the medication, but I didn't have that continuous shocking, continuous burning, continuous hammering feeling as much. After going through all this pain and doing some more research into, at least when I thought I had the trigeminal, I found out the nickname that a lot of people use for any kind of trigeminal pain or any kind of facial pain is they call it the suicide disease. After going through my worst episode that I had, I understand why. I was asking anybody to kill me at the time just because it hurt so much. And it's called that because there's people that have had this that they just couldn't take it anymore, and they actually did kill themselves. I saw a few different news stories where a young woman had been on all kinds of medication. She had different procedures done and nothing helped. I believe she was either her late 20s or early 30s when she killed herself. I've seen other stories where people of different ages, they decided to kill themselves because they just couldn't take this pain anymore. And it is, if you've ever had this, it's understandable. There's no nice way to put it. Luckily, medications are getting better, procedures are getting better to help with this. So I hope over time, as things get better and maybe as more of issue is known about and more people will actually get help they need to get rid of the pain so that people won't kill themselves as often. But it is extremely painful and extremely understandable how people can be driven to the point of suicide. So I understand where the nickname comes from. Because it hurt so bad, and the fact that I had the medications, I was adding one pill a day, getting up to that 1800 level. I'm sorry, I couldn't do 3 days in between. It hurt so much. And when I finally got up to the 1800 for a couple days, it did start to take the edge off the pain. Instead of the pain being clear to the back, it kind of brought the pain down, more focused in my forehead and around my eye, less in my jaw. That kind of, it brought it back to this area. I'm still sitting around with sunglasses on, even in the house with the shades pulled in a dark room. So I still had the sensitivity to the light, still had the pain and everything. I still had the Norcos, and he said I could take those too. I don't like Norco. I don't like Valium. I don't like a lot of those types of pain medications because when I take them, the only way I can describe it is I feel like I'm floating inside my body, if that makes sense. You're there, but you're just kind of like, wow, I'm here, but I'm not here. It feels funny, that kind of thing. Because I'd been on gabapentin for years, I had been to a pain doctor for several years that knew me. I ended up going a day or two later, I went to my pain doctor after telling him what had happened. He explained things better to me. He said the trileptal, it's actually a seizure medication. They weren't worried about seizures with me, but the side effect of the trileptal is it's a good painkiller. And when you mix it with the gabapentin, it works even better. He had dealt with people that had had the trigeminal neuralgia before, so he knew these two medications, and he said he wants to up my dose of the gabapentin to 2,400 milligrams a day. And the 1,800 milligrams of the trileptal were fine. And he said, yeah, I just used the 3-day rule. And I just went, oh, yeah, okay. I was already almost up to the full prescription by then, and it was still hurting. But he said it's kind of unusual that you have the light sensitivity. And I thought, oh, great. I don't even fit the normal pattern to treat it. It's something easy to treat. So I'm an unusual case now. And he said, well, he can see where everybody says that I have the trigeminal neuralgia. And so I finally asked, so what is trigeminal neuralgia? So he explained it to me. What the trigeminal nerve, well, the neuralgia means it's a problem with the nerves. It's something in the nervous system. He explained what the trigeminal nerve is. So on both sides of your head, you have one. I said earlier, you have a left and a right nerves in your face. It's split. But the trigeminal nerve starts out back here, somewhere behind your ear, and it connects to your brain. It runs up inside your skull, and it comes out what most people call a temple area. It kind of comes out in somewhere in that general area. And it's called the trigeminal because tri means 3. This nerve at this point splits into 3. Part of it is up here in your forehead, and then a second branch comes down, and then it splits again, and part of it goes in this area, and it's kind of the one that takes care of the top of your teeth, the roof of your mouth, and then that other nerve comes down and it takes care of your bottom jaw, your bottom teeth. If all this pain is rooted in this trigeminal, what do I do? So he said, well, there's lots of medications. Obviously, we got the trileptal, the gabapentin. We could try, there's other medications they can mix in or try something else. He said the Norcos may help bring it down to begin with. Sometimes it does, sometimes it doesn't. He says, well, this might just go away. If you had a virus or something, it might just go away. And I asked him about the shingles, and he kept saying, no, gotta have the rash to go with it. I said, but I've been told at this point, I'd been told by at least one nurse and a few other family members that you don't have to have the rash, you can have the pain. He said he's never heard of that, which is what a lot of doctors tell me. I was getting used to it at that point. I said, well, what do I do? I mean, I can't do anything. My life is pretty much stopped at this point. And by now, we're coming up on 2 weeks. It'll take a little while going with the 3-day rule, getting up to the level of medications, and it might take a week or two on these medications to see how they affect you. And I thought, okay, well, yeah, I'm already taking more than the 3-day rule because I'm still in pain. And he said, you need to get an MRI. What is this, the 4th, 5th time I've heard this? And I said, yes, I have one in a couple of days at the end of the week. And he said, well, take these medications, get the MRI, and come back. So I went home, took my medications, and then I went and got the MRI. While I'm sitting at home, and you start thinking, well, I happen to think back, and I go, I had been having headaches for maybe a month off and on before my first ER visit on the 16th, August 16th of 2021. But I didn't think much about it because it was July. It's the hottest time of the year. You work all day, and I'm lucky enough that at this time I have air conditioning in the building I'm in, so it's It's not 90, it's, 75, so it's not uncomfortable. It's not horrible to work in. It's not like I was in the heat all day. But when I get home, we're trying to take care of the yard, take care of the house, working outside. It is hot. And I just thought, I'm not used to being in the heat. It's just a headache from the heat and, putting in long hours, going to work, and then come home and working many more hours outside around the house. It's just a headache from, the stress of that, the heat, typical summer activities. I would take Tylenol and ibuprofen together, and usually it made it go away. Or by this time, you go take a shower, kind of cool down, and you just go to bed. Didn't think much about it. And then I also was remembering, some days my eye was kind of sensitive a little bit, my left eye. But, I always had sensitive eyes. I've always worn sunglasses outside because I was always super sensitive to the bright lights. If I was working around something that put off a bright light, like a torch or welding, I always added more protection to my eyes than what was required. I always went up a little more because I just naturally have more sensitive eyes. So I didn't think much about it. I thought it was just my normal eyes. It wasn't intensified by this pain. You just sit around, you just think about this stuff while you're waiting on the next thing to happen, which was the medication to kick in and my MRI. So I went and had the MRI done, and then I went back to the pain doctor. He said, "Well, I don't see anything on the MRI." Okay, so what do we do at this point? If you don't see anything, what do we do to make me better? He said, "Well, like I said, it could take a couple weeks for this medication to kick in. What could go on, if it's going to work, or we can start trying other medications?" And I'm like, well, that could take months. I can't be off work that long. I can't have my life stopped for that long. I need to do something. So he said, well, I can give you a referral to a neurologist to go see about this trigeminal neuralgia. And I said, okay, get me there, do something. So the next week, as far as I can remember, it was the next week because I was on these meds and I lost time, days and weeks, and just all blurred together. I remember going to the neurologist. We're in the office, and he's asking me questions. And he said, if you have the trigeminal neuralgia, there are some simple tests they can do just here in the office. They check some muscles, movements, but he said he needs to do some tests on the face. And they're very simple tests. When he first said that, I'm thinking, oh, they're going to stab me, needles, and no, it's just very simple test. People that have the trigeminal neuralgia are usually fairly sensitive to touch, to temperature, to sound, a lot of things that are very common to migraines, which looking back and learning what I have, I think there's a lot of people who have chronic migraines that are misdiagnosed. It's actually trigeminal, but that's my opinion. So what they do is he would just touch these areas on both sides. And these areas, and just kind of touch around your face. And he would say, well, how does this feel? How does that feel? So he would touch here and say, well, do the two sides feel different? And I'd say, well, no, they feel the same. Just my left side hurts. Does this? No, but the left side of my nose hurts. What about down here? No, they feel the same, but the left side hurts. And he said, well, that touching you doesn't make it flare up. I'm like, no, it hurt the same before as it did after when you touched it. And he's like, okay, well, that's odd. Again, he said, what about sound? Does sound affect anything? If you hear a loud noise, does that make the left side hurt more than, affect you more than the right side? No, that sound doesn't bother me at all, any more than normal. He said, well, what about temperature? If you drink something cold, does that make this nerve hurt? No. It was summertime, so the air conditioning was on. So he said, what about when you go outside and it's hot, and then you come back in to the air conditioning where it's cooler? No, that doesn't bother me. It just nonstop intensely hurts. He said, well, those are all the typical trigeminal neuralgia triggers. What about chewing? Does chewing do anything? No. Um, Actually, as long as I was on the meds, the trileptal has a side effect of weight gain, especially the high dose I was on, and the fact that I was sitting around doing nothing. I actually gained about maybe 10 or 12 pounds. So I had no problem chewing at all. It didn't hurt at all. Some people, they can't eat. Either it's the texture of the food, or maybe it's hard food, or the fact that they're moving this joint that the trigeminal nerves are in, and it causes pain. That was one of the things I learned after this appointment. I said, no, none of those typical triggers bother me at all. All I have is the light sensitivity, and it feels like my eyes being pushed out, and the severe pain, which wasn't as bad. The edge was off a little bit because I was taking the trileptal and the gabapentin, but it was still severe. So he says, well, it could be trigeminal neuralgia, or it may not. It may be something else. So now I feel like we don't know what's going on. Am I back at square one trying to figure out what's wrong with me? He said, well, I'm going to send you to a Neuro Surgeon, which is obviously a scary thing to hear. He said he wants him to look at my MRI that I had, do an evaluation, and see what's going on. Okay, I mean, it's just a consultation. It's not like I'm going to go in the first time they're going to start cutting me. Although, at this point, I'm the type of person that says if you could find something and cut me open and fix it, just do it, because this pain was so intense. I told him about my ER visit, how bad it was, and he said, actually, that's very normal for people that deal with these kind of nerve pains, especially in the face. Is extremely sensitive. They do feel like they want to die. It's actually a very common thing to say. And the scream, the cry, it's actually common for this type of issue, which sort of made me feel better that it wasn't just me, that it's actually a common thing. But at the same time, it hurt so bad that I didn't know how that could be normal without some sort of trauma, a car accident, or some sort of something fell and hit me, just how could you be in this kind of pain for no physically apparent reason? As I've learned, this happens. Not exactly sure why, but this happens to a lot of people. I call it uncommonly common. As I said earlier, 1 in 1,000 women and 1 in 2,000 men. That sounds like something that should be very common, should be very common knowledge. But how many people know 1,000 women or 2,000 men to statistically know one person that has this? So it's something that happens to a lot of people all over the world of every age, but it's also not very well known because it may happen a lot, but it's such a low number. And I think there's a lot more people that have some of this issue, but they never go to the doctor, or that's misdiagnosed. So I'm actually thinking those numbers are higher. There's a lot of times when somebody else, you'll say, man, my head hurts. There's no outside damage, or there's nothing there. And a lot of people go, oh, whatever, just take some Tylenol or Advil, or, take something and you're fine. They don't want to believe you. Unless you've had an intense episode like I did, or you were around somebody who had that episode and actually seen it, you probably won't believe it. I know I wouldn't have believed it beforehand. Now, obviously, if anybody ever says something, I'll be thinking about what I went through, and I'll be more likely to push them to go to a doctor instead of just take something and you'll be fine. I'll be like, go to the doctor, check all this stuff. I'll be a little oversensitive to somebody that says they have headaches now. But that's just from experiencing it. Anyways, back to the neurosurgeon. So he says, I was able to get an appointment a few days later for a neurosurgeon. So I go in, and he opened the MRI. Actually, it's the first time I got to see my own MRIs. And he's scrolling through, and he's talking about different things. And, we look at my left side, and he would look at the right side to compare them, and just to make sure that there was no differences. There's not something that shows up on this side that doesn't show up in here, kind of an obvious thing, like, was there a blood clot? Was there a tumor? Was there something going on in the side of the head? Everything looked fine, he said. Okay, well, if it looks fine, then why am I having this pain? Well, he honestly didn't know from that MRI. And he said, well, let me do some tests. So he did all the same tests, the touching, the feeling, checking some other motor skills that the neurologist did, and couldn't find anything either. He said, I want you to get another MRI. But what he wanted was what they call high resolution MRI. He wanted more details because he said, in the MRI I had done, maybe that detail they needed was between the image layers. So he wanted to have a more high resolution one that had more image layers, just to double check to make sure that I wasn't missing something. I left his office. I had an appointment with my pain doctor as a checkup since I'd been on medications for a while. He wanted to make sure I was taking the medications, that they weren't causing something else, that they were working, and they were starting to work a little bit. I still had the light sensitivity. I still was having quite a bit of pain, but it wasn't as bad. The edge was off a little bit, but it still intensely hurt. So we started talking about options. I told him I was going to get another MRI, but I couldn't get it for a couple weeks because it's a more specialized MRI, and it would take a couple weeks for me to get in the schedule to get this MRI. So he said, well, the medications are doing a little bit, but so there are other options we can do now before you can get the MRI, before you can move on to something else. So he said one of the easier things that they could do is a nerve block. Okay, well, I never had one, didn't really know what it was. He said, well, it's a simple procedure they just do there in the office, try to cut down the pain. What they do is they just take a small needle, and since it's on my left side and it's up in this area, there's a nerve. He said he's not convinced it's the trigeminal. There's other nerves that come up through here, down through here, that come through your skull at different places and take care of all the feeling you have in your skin. He said he thinks it's this nerve up here. And at the time, I didn't know much about where these nerves are. He said they could do an injection here. What they do is they put a local anesthetic so the needle doesn't hurt as bad. So you feel a couple of pokes at first, and then you give it a couple minutes. And then you inject a steroid in there, and I don't know if there's something else, right into the nerve. And that should help kind of relax the nerve, take down some of the pain. And I'm thinking, well, it's a small needle, and if it's going to take some of the pain down, then let's do it. I made an appointment to come back to get this nerve block done. He said it only takes like 15 minutes. It's real quick. I left. I was also able to get my second MRI scheduled, and it just happened to be the same day that I'm having the nerve block. That week, which was the following week, I think, it seems like I went to 6 or 7 appointments in a week between doctors and procedures and different things. It was a day or two later. I know taking pain medications, they'll constipate and cause other issues. So I was trying to take other over-the-counter stuff to keep from getting issues from like constipation, since I'm taking some pretty high-dose painkillers. And I ended up one day, I was so constipated, I was sick, I was vomiting, I couldn't do anything, I was in severe pain. So my wife took me back to the ER for the 4th time in 2 weeks. I was in the ER. The doctors were starting to get to know me by then, and it wasn't happy to see me. So I remember going to the ER, and the doctor walked in. I'm like, hey, do I know you? And the doctor just kind of gave me a weird look. He's like, why are you back here? And I said, well, I'm on these medications, and they're basically plugging me up. And I said, I need you to give me something to stop the pain and stop the vomiting, because I can't take my pain meds. My pain up here is starting to get more intense because now the meds that were in my system are wearing out, and I can't take more because I can't keep anything down. So I needed something to loosen me up basically and calm down my system so I can take these pain meds to keep this pain down before I'm back in here screaming and crying again. So they gave me a bunch of stuff in an IV. We talked a little more about how to try to manage medications, some things I could keep from this happening again while I'm on these medications. he said, well, you should go see a GI doctor, really, because they know more about it than just your family doctor. And I said, it's funny because I actually had a GI appointment the next day because I said earlier that I've had IBS for over 20 years. I had taken the test a month or two earlier. This appointment with the GI doctor was to get the results. I said, it's funny, I just happened to have a GI doctor appointment the next day. And he said, well, the GI doctor will give you more medications and help you figure out what you need to take because you're taking so much of pain medication. The ER doctor comes back in a few minutes later and he goes, I'm going to give you 3 prescriptions. One of them is called promethazine, and it's a syrup. He said you take about 5 milliliters at a time when you eat it, and it's for nausea. He gave me dicyclomine, 10 milligrams, which he said if you're having these cramps again, you could take that to help relieve the cramps. And the third was ondansetron or something. It'll be in the description. It's a 4 milligram tab, and he said that's for nausea and vomiting. And he's looking through my chart, and he goes, you've been in here before with IBS issues and different things. I'm like, well, yeah, I've had it for a long time. So he's flipping through my chart, and he's looking, and he said, I'm going to tell you how to take these meds. Take this one so many a day or so many times a day, and this other one at different times. And he said, you kind of go back and forth between them to try to cover everything. And he said, they're as needed. And he says, I'm going to put the instructions on there. But he goes, you know what? As many medications you have listed here that you've been on and off of over the years with your IBS issues, he goes, you'll figure it out. Just here's these medications. You'll figure it out. And I thought, well, that's the first time a doctor's ever told me, here's a bunch of medications. You'll just figure it out. They gave me a bunch of stuff in the IV, sent me home. I felt better. And the next day, went and got these medications. Picked them up, looked at them, read them, and go, well, he told me to figure it out, so I guess I will. So I go to the GI doctor, and he's going over my results for the test I had done. And the good thing, and also the bad thing is, he says, well, there's nothing in the results of these tests that tell us why you have the IBSD. IBSD means irritable bowel syndrome with diarrhea. It just means I go to the bathroom a lot and sometimes a very short notice. I'm normally taking medications to slightly constipate me, basically. So after he gives me the results of the test and he says, or he's getting ready to start in on what I can do, and I'm like, wait a minute. I said, my situation has totally changed since the last time I'd been down here. So I told him about everything I'd been going through, that worst attack that I had, and he'd never heard of that kind of issue before, but he's a GI doctor, not a pain doctor. He said, well, with the medications you're on, you're not going to need something to help you stop going. You're going to need medications to actually help you go now. It's the reverse scenario. It's like, yeah, I said, right now, everything we were working on in the past is going to be on hold because now I'm taking such high medications that I don't need whatever you're going to give me. I need something different to help me go, basically, because all these pain meds constipate. And he said, yeah, those are pretty normal to constipate. So he said, get over-the-counter meds. He wanted me to take 2 different things. Docusate sodium, which is just a softener, stool softener. And he said it comes in a liquid, comes in a pill, whatever. I said, I'll take the pill. And something like a Dopalax, some sort of over-the-counter, basically diuretic, help with the constipation that the Trileptal and the gabapentin and the Norco will cause, is causing. I was also taking something called Gas-X, but that's because of the bloating you get from all this stuff. So here I am adding 3 more medications to everything I'd already been taking. And he said, well, I'm going to tell you, you need to start out taking this amount of the softener and this amount of a diuretic. He's looking through my chart again, and he says, well, I'm going to tell you to start at this point, but he says, you know what? You'll figure out how much you need to take to counteract what your medications you're on. I'm thinking, all right, 2 days in a row, 2 different doctors are just throwing medicines at me going, you'll figure it out. I've never heard of that. Neither has anybody else I've ever talked to. Usually they want you to stick to a very prescribed amount and prescribed time. Everybody's just going, nah, you're in pain, just take what you need to take. You know, you need this stuff, just take what you need to take. It was just very, very odd. Now, I had also been on some other medications for the IBS called pantoprazole and sucralfate. Anyways, they help with like stomach acid, the stomach pain, the intestinal pain, the reflux, that kind of stuff. So if you add up all these pills that I'm now going to be on, it ends up being 27 pills. Right now I'm at 26 at this point. That's because after I went to the GI doctor, my mom, my daughter, my wife, my sisters, everybody said I need to go to my doctor and get something for emotional state, because one of the side effects of taking the Trileptal is it will make you extremely sensitive as far as your emotions. Plus the fact that I was screaming that I wanted somebody to kill me and I wanted to die because I was in so much pain worried them. So I went to my family doctor and he put me on 20 milligrams of Cymbalta. He said it's for your mood, but it also has a side effect. It helps with pain. And I said, oh, I'll take it if it's going to help me with the pain, because I'm still in intense pain. I'm still wearing sunglasses. I was even wearing a patch for a while. If I had to go outside, I'd put on a patch, put on sunglasses, and even put on a hat just to stop any light I could from getting into that eye. If you throw the Cymbalta into all these other medications I'm taking, I'm on 27 different pills. I took a picture of all of these. I'll put the picture up now. You can see in the boxes. In box 1, the sucralfate and the pantoprazole, those are ones I've been taking for a long time for my stomach. Box 2 is pain meds. The Trileptal, the Norco, the gabapentin, and Cymbalta. Those are the ones that were helping with the pain, but they also cause the side effect of the constipation. And box 3 is basically everything I need to take to counteract the constipation. Yeah, I'm on 27 different pills at this time. I put a quarter there at the top of the page just so you could see, to reference the size of all these pills. I felt like a drug addict just taking pill after pill after pill all day long. And I did that for, I think I was taking all those for almost 2 months. At the point I'm now taking all these pills a day, I was starting to get some side effects other than the constipation. And I found out later on, talking to a specialist, which I'll get to, most of these side effects are from the Trileptal. And they're common side effects. But here's a short list of things I dealt with as side effects when I was on the Trileptal. The one that bothered me the most is I would get tremors. My hands would just shake like this all the time, no matter what. If I'm trying to do something on a phone and the phone's shaking, and you're trying to touch something and I would hit the wrong thing and I'd eventually get pissed and just put the phone down. But just the constant, mostly in my hands. Every now and then I'd get just a jerk. I might be sitting there doing nothing but watching TV and my body would just jerk. It wouldn't hurt, it would just move. Or your legs would jump, or maybe my arm would kind of jump. It gave me tremors, and I think that was the worst thing. It also made me sleepy. Some of that was the Norco I was on. The gabapentin doesn't really bother me because I'd had it. I hadn't had 2,400 milligrams, but I had been on gabapentin for a while. So that didn't really bother me too much. But the Trileptal, I would take it and I'd be out for a couple hours. And I would sleep most of the day and I'd sleep most of the night. And I just lost so much time. It was just all a big blur because of this medication. It also made me very dizzy. If I got up to walk across the room, I'd get dizzy. My balance would be off. I'd have to follow a wall, put my hand on a wall, or if I was someplace where there was a table, a counter, or something I could grab onto and hold so that I was stable enough, walk without almost tripping over nothing. It made me extremely sensitive. I'd be watching a movie, and it might be an action movie, and all this stuff's going on, and I would just start crying. Of course, my wife would want to watch a Hallmark movie or something, and I'd cry the whole movie. I couldn't control it, and it wasn't like I felt sensitive or I felt like I needed to cry, it was a super emotional event, I would just sit there and cry. Just constant water, anything, any little thing would make me cry or whatever. The weight gain, I said earlier, I gained 10 or 12 pounds. I felt like I was always in a fog. I know a lot of pain medications do this, but yeah, I was just in this haze or this fog in my head. No idea what time it was. I just knew I was home. Didn't know what was going on right next to me. Out of it. Foggy, out of it. I'd also had this, I said earlier, this floating inside your body. It's like you knew your body wasn't moving, but inside your body, it was like I was just kind of floating around, not really in control. Just a weird feeling. And then memory loss was a very common one. I don't remember days. I don't remember weeks. I went to some doctor's appointments. I don't remember them. It's a good thing my wife went and took notes because I kind of remember going, but I don't really remember going. I was out of it. I don't like the Trileptal. It helped, but all of these side effects were horrible. It also left this weird taste. I had this constant bad taste in the back of my throat, and it didn't matter when I took it. It was just always there. Everything I ate or drank tasted funny. I couldn't wait to get off of it. It worked. It was a good painkiller. It worked, but it just was a nasty taste, and all these side effects just made things a lot worse. I had the appointment to go to the pain doctor to do this nerve block injection. So I go in, you lay down on the table there in the office. The first part of the shot was the numbing, just numb the area. Waited a minute, and as soon as he put the numbing in, I felt better. I finally had some pain relief because he just injected a numbing agent into me. I didn't even feel him put in the steroid for the block. All I know was the first time, I think by now it had been, I don't know how many weeks, I finally had some real pain relief for a little while, at least. I actually come out, I was not quite as dizzy, not quite as off because I just felt better. I had some pain relief, finally. And it took quite a bit of it away. And I also noticed my eye wasn't as sensitive then too. The same day that I did this nerve block, I also had the MRI. He told me when I go get the MRI, just to let him know that I had this done because now I've got all this fluid in my head up here under the skin. Make sure they note that because you don't want them to think that that fluid that's in there is what's causing the pain. Just let the MRI tech know. He said these nerve blocks they can do, you just have to have so much time in between them. It's something that I can do basically the rest of my life to help with the pain. And I thought, you know what, if I got to come in every couple of months or something and get this done just to be able to go back to my life, then I will. And he said it's not a big deal. A lot of people come in and get nerve blocks for various reasons in various parts, and that's what they do to survive. So I came out feeling pretty good. But then I had to go straight to my MRI appointment in about an hour. The whole drive down there, I was feeling good. I could actually see somewhat. The sensitivity was reduced to the point I didn't need a patch. I still needed sunglasses and a hat, but I didn't need the patch over my eye. A lot of the pain was gone, at least for a while. So I get down to the MRI, and I'm in the machine, and this high-resolution MRI took a lot longer to do than the first MRI. The numbing started to wear off while I was in the machine. Luckily, it was toward the end of doing the scans that my headache was starting to come back. Being inside that machine, if you've ever had an MRI, it makes loud banging, it makes loud noises, it makes all these weird noises, and it's just very, very loud. I would say the nerve block probably took a third to a half of the sensitivity away. I finally had some relief. I still had to take the medications, but it took a lot of that pain away. The pain doctor told me, wait up to a week for this full intensity of the nerve block to kick in. When I left the MRI, yeah, it was starting to hurt a little more, but I could tell there was a difference. On the way home, I started feeling kind of bad again because the topical numbing had worn off, but I was better. Over the next few days, I tried to reduce the Trileptal because I hate that stuff. As soon as I reduced one pill, the pain level went up, and I thought, okay, we'll give it a little bit. And I waited a little longer, reduced another pill, and the pain level went up. And I realized, oh, I can't reduce the trileptal even with the nerve block. So I had to go back to the full dosage of trileptal, and then the pain dropped. So it helped. I hated it. I don't ever want to take trileptal again, but you know, if I need to, I will for the pain. So I did feel better, but I'm not functional. I haven't driven at all by this point. I didn't drive for about maybe 4.5 months total, actually, just because of all the side effects of all these medications. I had another appointment with the neurosurgeon after we had this second MRI. He looked at all these scans, did some more tests, touch, feel, sound, you know, all that stuff, and nothing had changed. I just had the pain. I said it had been reduced because I had the nerve block done. The surgeon was wondering if I needed what they call an MVD, microvascular decompression. I'd never heard of this, didn't know what it was. I just knew it was surgery. So he's looking at everything and he says the MVD is a very common thing for the trigeminal, for this nerve in here where it comes back and hooks in. He said it's very common surgery. But he's looking at all my scans. He looked at the first MRI, he looked at the second MRI, and he's like, I don't think you have trigeminal. He said you don't fit the typical profile because you don't have the sensitivity triggers that are common. The pain in the eye is not common to trigeminal. He says that you have something else. Great. What do I have? If you have trigeminal, he would do the MVD, no problem. And it would show up on the MRI. But it wasn't showing up on the MRI. Everything looked fine. The first one looked fine. The second one looked fine. He said, so I don't think you need a surgery, which, you know, on one hand, that's great. I don't want a surgery. I don't have to have. But on the other hand, it's like, but if we knew the cause of the pain, I'll do the surgery to get rid of the pain. He said, you don't have the normal trigeminal. It may be part of the trigeminal, but it's not the cause. He doesn't recommend having like the MVD surgery or anything. He said, at this point, it's not surgical. It's a neurologic. It's something else that you need to figure out what's going on. There's nothing that he can do as a surgeon that's going to help me at this point. And if he does anything, it's going to be exploratory or it might actually make it worse. I guess that's it with the neurosurgeon. So he told me basically go back to my pain doctor and let them figure it out. So when I got home, I started looking up what is the MVD, just to find out what this is. So I'm going to stop the camera. I'm going to draw something on the board back here, and then I'll explain what MVD is. And if you really have trigeminal, it seems to work. Regardless of what you hear, if you watch YouTube videos and read stuff, you'll hear all the bad stories. That's because the people that have the good stories don't get out and complain about how bad it was. But I'll do a quick demonstration of what MVD is and explain it and understand why I'm glad I didn't need it. Here's the drawing I said I'd make and explain what microvascular decompression is. What happens is people that have this trigeminal nerve, that have true trigeminal neuralgia, this is the most likely cause of what it is and how to fix it. So you got this green line here with these little fingers on the end. What that represents is the nerve bundle, basically, that's inside your skull, and it comes back here behind your ear and attaches to your brain. So let's just say these little fingers are where the end of that nerve attaches to your brain. This red U-shaped part, what that is a blood vessel. This blood vessel will work its way down behind this nerve so that it's between the nerve and your brain. Some people are born this way. Some people, over time it changes, I guess. Various reasons. The doctor said that this happens. But what happens is this blood vessel is pumping all day, every day. And it's wedged between a nerve, a bundle of nerves, this green section, and your brain. And it's just in there pumping and pushing. What happens is this blood vessel actually wears through the coating of this nerve bundle, and actually rubs on the nerves, and eventually it wears through, so it's through the coating and actually to the nerves and rubbing on a raw nerve. And then that's when you start getting this pain up here, and it could be any parts or all of that nerve out here in your face, and it's so intense because it's directly on a nerve, um, and it's what causes this intense pain. So how they fix this is they actually take and they'll actually take and cut you open back here and open your skin to expose your skull. And then they will take and cut a hole in your skull wherever the MRI show. They actually drill a hole in your skull. And then what they have to do is they can't just cut the vein. They can't just cut the nerves. And this is right against your brain. You know, let's say the white board is your brain. You're messing with some pretty serious stuff here. They can't remove it. They can't just disconnect it. They can't just cut it because this blood vessel supplies blood to different parts of your brain. So what they have to do is they go in through this little hole, which is somewhere between the size of a nickel and a quarter, and actually move the blood vessel. So they go in here and they cut away whatever tissue they have to move this blood vessel so that it ends up like this, away from the nerve, and you still have your blood flow. And then they will take this material, and they said it's kind of like a pillow that they put in here, and it protects that blood vessel from being able to come down and touch that nerve again. And then they replace the piece of your skull, the piece of bone they took out, and then they close it up. And you end up with this big scar behind your ear. That's what an MVD surgery is. And at first, that's what I thought I was going to need, was something very intense like this. For some people that really need it, I guess it gives them instant relief sometimes, or relief over time as that nerve bundle repairs itself and gets a coating over it again. I'm glad I didn't need this. It ends up that the surgeon said I don't have this, which is the trigeminal neuralgia issue. He said what's going on is actually further over, and it's what I found out later on is called the super or supra, depending on where you read it, orbital nerve, which actually comes out from your brain, behind your eye, comes up over your eye, and then up across your skull here in the eye socket, and spreads out, and it also comes in this area, and it kind of goes around about to the middle of your eye. He said most of your pain's centered there and centered around the eye. He thinks that's what's causing the pain, is supraorbital, not the trigeminal. He said if he was to do the surgery, it'd be a waste. Well, that's good. I don't want the surgery if you don't need it. But there's nothing else he could see to do. The only thing he did do was he gave me what they call lidocaine, which is a very low-grade topical pain reliever. I've heard a lot of people use it. He gave me these patches. Here, it's actually about this big inside of here. They only come in one size from what I've been told, these big patches. And he said, just take and cut them to kind of this shape of your face, this area you need, and put those on. You can wear them for up to 12 hours. They're lidocaine 5%. So I did that for a while, and it was kind of hit or miss. Some days I'd put it on and I could feel it help with the pain a little bit. Some days it didn't seem to do anything at all. You can also get over-the-counter cream. It's only 4% lidocaine. That helps some days because you can't put a patch up here in your hair or here in your side. So it comes in a tube or a bottle of cream, and I would kind of rub that in some of the spots that hurt. Plus, then I didn't have a patch pulling on my skin. The neurosurgeon recommended that. I could also use those two things to help with the pain. Now I have the cream and patches I can use. I have the medications I'm on. I've had nerve block, which helped, and they wanted to give that some time. So I'm just kind of stuck. I can't do anything because of all these side effects from the medication. I'm still in pain, so that is another reason I can't do anything. I'm just sitting at home doing nothing. I went to a couple pain doctor visits, and that was more of a, how are things going? Do we need to adjust medications? He increased some stuff. And I told him I was on the Cymbalta, 20 milligrams at that time, and he said, well, we'll up that to 60. We can take that up to 60 for the pain. And because of how sensitive I was from the Trileptal. And he said, at this point, there's some things he can do. He said, I think you need to see a specialist that takes care of atypical facial pain. And this is the first time I'd heard of the atypical facial pain diagnosis. I said, well, this isn't something you can do here in the office. There's not something else. He said, well, I can do the nerve block, but you have to wait so much time between them. You can't just keep doing them to make it go away. He said he really thinks at this point, with everything I've been through since the MRI showed that this wasn't the problem, that I should go see somebody that is a specialist in atypical pain. So that's when I did some research, and the doctor did some research, and we came to the same conclusion that there's a doctor at Cleveland Clinic. If you've never heard of Cleveland Clinic, it's originally in Cleveland, Ohio, but they have several locations across the country. They even have locations in other countries. It's a specialty hospital. That's all they do. Is every doctor there has some sort of specialty or is in training for a specialty. So we found this doctor, and I couldn't get in for a month. I want to get in as soon as I can. I don't want to wait any longer. But I had to wait a month. First appointment's always a consultation, and for me that's a couple of hour drive to get to Cleveland. I think it takes me about 3 to get there from where I live. I get down there and I talk to the actual doctor that does procedures, and then also he had a doctor in training. It's somebody that's already a doctor, but they're learning their specialty and they're practicing their specialty now. They're upgrading their license. So I go down, I talk to him, we go through all the questions, we go through all the tests, does this hurt, does this hurt, does it, all this same stuff I've been through this time and time again. They said, there are other medications, but you're really on the best ones. The Trileptal and the gabapentin are really the best ones. This doctor is also one that confirmed you do not need a rash to go along with shingles. You can have the nerve pain without the rash, but at this point it's too late. If I did have it or do have it, it's not going to go away. The pain's there, and I need to manage it. What they told me is they have a couple of procedures. The first one is called RFA, and it's actually what I had done. It's called radio frequency ablation. So he looked at all my records I had and things, and he said, he's not going to mess with this trigeminal. He said, we can do the RFA up here on the supraorbital. That should help take care of a lot of the pain. And it's something that I can have done multiple times over my life, depending on how long it lasts. When they do an RFA procedure, usually you get a minimum of 3 months out of it, or you could get as much as a year, 2 years, 5 years, depending on how your body reacts to it. So I thought if I can get at least 3 months out of it, and I may not be pain-free, but if it's a fraction of what I've been in, and I don't have a severe attack again, like I did that day that I wanted to die, I'll come in and do it. He says, okay, we'll set you up, we'll get you on the schedule, let's come back and we'll have an RFA. So we go out to the receptionist, and she says, okay, we'll try to get you in the schedule. And she was looking around, she goes, and I was there on a Friday at Cleveland for this consultation. She goes, oh, we just happen to have a recent cancellation for next Friday at a time that they could do this RFA. And I'm like, I'll take it. At this point, I don't care, I'll take it. And she's well, depending on your insurance, they may have to do a pre-approval, and we don't know if we can get that done the next week. I'm like, I don't care. I will be here next Friday. You tell me whenever the appointment is, I will be here. We will deal with insurance. We will deal with whatever later on. I finally had some better news. I only had a week to go. I thought that's good. I only got a week to go. So the following week, I come back, and luckily the only prep I had to do for this procedure was not eat for 8 hours. The RFA, the radio frequency ablation. Now that I've had it done, it is a quick procedure. It helped immensely. I'm almost back to the sensitivity I was before. I don't have a lot of pain. I just have a funny feeling. It kind of numbs parts. Like up in this area and even in my jaw, sometimes I feel like maybe a little pressure. Every now and then you'd get a poke, of pain, or, maybe kind of a slight headache, but not the pain that I was on. And the RFA procedure is fairly easy, actually. What they do is you go in and they put you in a gown like you're having surgery, and everything is kind of the same prep as that. They give you an IV. You're not asleep during this procedure because they ask you questions while you're there. They get me all ready. You get in a gown, hairnet, and all that. They take you in to the surgery room, and you get up on the table and you're laying there, and they marked out and verified that this is the right side. Sorry, this is the correct side, my left side. And then because of it being right next to my eye, they put like gauze over my eyes so I couldn't see anything except these little cracks of light. And then they covered the rest of me up since they were only working in this area pretty much. They didn't want to expose everything else. So they were putting all those green sheets that they put, or blue sheets, over you and things. So I couldn't see anything. And just before they started in the procedure, they said, okay, we're going to give you some meds. And I'm not sure what they gave me. I think there was 2, maybe 3 meds. Is what it does is they relax you. They take some, it's supposed to be something for pain, but it's more to relax you, because when you're in there, a couple of shots of numbing in there beforehand. And then since I couldn't see, I didn't even know what was really going on. Apparently they put an ultrasound machine above my head. Like I said, I can't see anything. What they do is they ultrasound the area because they need to see the nerve. And I could feel the doctor touching this area, and he was looking for the nerve is what he was doing. He's looking at the ultrasound and he's feeling it. And then the other doctor was also there, the one that's in training, and he was feeling on the other side, just trying to learn. I had asked the doctor in training came in and seen me before the surgery. I didn't see the doctor doing the procedure until we were actually in the surgery room. This doctor in training come in before the surgery, and we were talking about the medication and stuff, and I asked him something about this, and he goes, I don't know, I've never done this procedure before. And I started laughing, my wife started laughing, and he's like, oh, I'm not going to do it, I'm just going to assist the doctor doing it. He says, I won't be the one actually doing anything to you. And I just started laughing. I said, it's fine, I get it, you got to learn somehow, but that was just weird. I'm asking you questions, and then you tell me, oh, I've never done this before. So anyways, they're feeling around. By now, some of the numbing was kicking in. What the doctor or surgeon did is he took, to me, what felt like just a needle, but this apparently was attached to a machine. And it was putting out a very small amount of voltage, I guess, and he stuck it in the nerve. Luckily, he hit it the first time. He didn't have to poke around. So he stuck it in the nerve, and all of a sudden I felt my whole forehead tingling, clear down to here, around. It was even tingling up into here a little bit. Felt like maybe static electric, kind of tingling, everything, vibrating all those nerves. And he asked me, he says, do you feel it here? Do you feel it here? He's touching me, and feeling in all these spots. And I'm like, yeah, I feel this funny tingling. He goes, okay, that means he got the nerve, luckily, the first time. He says, okay, now don't move, which I wasn't anyway, because you got a needle in my head, and your hands kind of hold me down, and you got other people kind of hold my head still. And he said, just hold still, we're going to do the actual ablation at this point. I remember him telling one of the nurses or surgical techs or somebody, I said, okay, set the machine for this much. All of a sudden I felt a more intense tingling and kind of a burning. It kind of hurt, but it wasn't that bad. I mean, if you figure the intensity of the pain I'd had weeks before this, or actually almost 2 months before this. Compared that pain to the pain I had at that point, plus it was half numb. This, I would, in a heartbeat, I would do this RFA again. Because yeah, it kind of hurt. And he had that needle in there for, I'm going to say, maybe a minute. Because he was kind of counting down, and he's like, well, we're halfway through, and it's kind of burning a little bit, burning sensation. And it hurt, but, he's like counting down, so it wasn't that bad. And then he said, okay. And he told the other person to turn off the machine, pulled the needle out, and I was done. That was it. And I heard him say something about, recording. Somebody was in there recording everything that was being done to me. And I think he said that they had basically put 4 volts of electricity into that nerve, but it took the pain extremely down to the point it's almost not even pain. I get this weird feeling. Sometimes it's kind of a pressure feeling. Sometimes it's just kind of a fuzzy, funny feeling. The pain of having it done was nothing compared to the pain of just daily trying to survive. The only thing you could see after they did the RFA, and I tried to take pictures of it, I couldn't get a good picture where you could really see what it looked like afterwards. It was swelled around my eyebrow here, and it was kind of swelled up above it. It looked like you got hit in the head with a baseball, basically, and it swelled up, but there was no bruising. It was just swollen. It hurt for a couple of days. Sometimes if you touch it right in that area hard, like at first it's kind of fuzzy, but if you push on it a little bit, it kind of hurts. But how often do you sit there pushing on your head? But I would do the RFA, no doubt, anytime I needed to. And it's one of those procedures that you can do multiple times through your life. Good way, I guess, to hold off any major surgeries that could cause more damage. Because the first thing I ask is, can he just cut that nerve and make me numb? And he said, actually, cutting the nerve will make you numb, but it won't take long. It'll cause more pain as that nerve tries to regenerate. What the ablation process does is, if this is your nerve, this is inside here, you have all your individual nerves inside this bundle. What the ablation process does is it actually damages this outside coating that is over your nerves, or the nerve bundles. And what that does is when you damage that the outside sheath, the outside coating, is it actually messes up the signals on the nerves inside. I don't exactly understand why it does this for sure, but that's what my doctor told me it does. Yeah, you end up with a little spot where they put the needle in, a pain. It hurts a little bit having it done, but I would in a heartbeat go back and have it done if I start having the intense pains again. Without thinking, I'd go get it done. And I would recommend anybody that's going through this nerve pain to do it. As long as they go to a specialist like I did, like at Cleveland Clinic. I know there's other hospitals around the U.S., especially, but around the world that are specialty hospitals. Find somebody that's a specialist for whatever the nerve issue you're dealing with. They told me wait about a month after having this RFA done, and then go back to your pain doctor and let them do a checkup and see what's going on. Unless something happens and I need to come back, if I start having a reaction or something, I need to come back to Cleveland. For me, it went fine. I started trying to do some little things around the house now that I wasn't having the pain. Immediately, I started reducing the trileptal. And I actually, at this point, am off the trileptal, finally. I'm still on gabapentin, but I'm taking 800 a day now instead of 2400, so I'm down to a third at this point. I still take the Cymbalta for pain, but I don't need Docustate sodium, I don't need the Gas-X and the Docalex, those kind of things, because now I'm finally somewhat back to normal. I'm off a lot of those medications. I feel a lot better, and I'm actually able to safely drive again. At this point, I'm pretty much as good as I'm going to get again. I'm going to have pain up here forever. It's going to come back at some point. I'm going to have to go on medications, have nerve blocks, maybe go back, have this RFA. It's just, from now on, that's going to be my life, and you just got to get used to it. But I actually have a life again. It's been almost 5 months that I've been basically worthless, sitting around, not doing anything. So it's finally a relief that I'm not going to be that way forever. I do have options. There are much more invasive options, which I'll do a quick explanation of here in a minute. But I'm finally somewhat back to normal. Now, I scheduled my 1 month appointment with my pain doctor, and I was looking forward to it because I'm thinking, okay, he's gonna, release me. I can go back to work. I can, do that kind of thing. And I got COVID. Actually, my whole family got COVID about a week before my appointment. So I went from feeling so much better, getting off medications, the trileptal, reducing stuff, back to being sick with COVID. Now, the funny thing is, because I had this RFA done here, and COVID causes nerve pain because it's a virus. It causes the nerve pain, it causes the body aches, all the same things you get like with the cold and flu, those kind of things. It was funny to me that when I had COVID, my body hurts, my nerves hurt, but this whole part of my face and these nerves and all the way at the top where they did the RFA didn't hurt at all. It was the rest of my face hurt and my body. And I actually told my wife one time, I said, I wish I could go back to Cleveland right now and they could do the RFA on this side so that it wouldn't hurt because of the COVID. I was that willing to go back and do the procedure again just because I was hurting from the COVID. And I did eventually get over COVID and go back to the pain doctor to get a work release. So at this point, I'm just going to have to deal with the pain, handle it day by day. I take medications as needed. I'm down to the point where I can take Tylenol again and then it'll actually be effective. When I was on such high levels of trileptal and gabapentin, Tylenol wouldn't do anything. And one doctor told me, do not take ibuprofen when I feel like that, because you get into a cycle of, you take the ibuprofen thinking it's going to make you feel better. And then it doesn't work, so you take more. And it's not working, so you take more. And then actually, some of your pain could get worse. So you take the ibuprofen again, thinking it'll make your pain better, but it actually makes it worse because now the ibuprofen is actually working against you. So he said, if it's pain, nerve pain up here or anything, don't take ibuprofen. Try Tylenol first, and if not, go back to, I got gabapentin I can go up on. I got the trileptals I'll keep around. I can go back on those and then start the process of figuring out what I need to do to get the pain back down. If it's another nerve block, if it's going back and having the RFA again, whatever it is. I just have to take it day by day, deal with the pain. My body's getting used to a certain amount of pain. Sometimes when it doesn't hurt, it kind of confuses me for a minute because it's like, well, wait a minute, why don't I hurt anymore? I've been hurting for 5 months. Anybody watching this has this nerve pain or has family with it, there are things they can do. I've told you some medications. I've given you some recommendation for types of doctors you should get. So don't wait. Don't suffer with it. I watched some videos where people have been suffering for years with pain. Find somebody to help you or them, whoever it is. Just get it done, get it fixed, put your life on hold. 5 months for me was an extremely long time. It felt like years that I didn't do anything. I missed out on a lot. Do something for it. And if your doctors aren't doing anything, go to somebody else. Don't wait on your family doctor or whatever to try to figure it out. Find a specialty doctor and move on and get it fixed, whatever it is. I've heard of a lot of people that have similar pains and they just keep saying, well, I like my doctor, my family doctor, but they're not a specialty doctor. They're not trained for this kind of stuff. Find the doctor, find a neurologist, find a neuro surgeon, whoever, pain doctors, specialty doctors, whatever, and move on. So I said I would tell you about a few other options. I'm just going to erase this quick. A few other options that I know about if the pain gets worse and the RFA doesn't work, nerve blocks don't work. So the doctor at Cleveland was telling me if the RFA doesn't work or eventually doesn't work, if I do it 5 times in my life and then find out, it doesn't work anymore, there's another option they can do, and it's more invasive. and it's an actual surgery. So what they do is they somehow fish a wire. I really think he said it's about the size of a piece of hair. They put this wire all the way in under your skin, starting back here, and they fish it around up to the nerve. In my case, it's this one up here. They fish this wire in and stop it at the nerve, stick it in the nerve. And then back here, I'd have a wire hanging off. And then I would have this little unit. He says it's about the size of like maybe a pacemaker that you plug this wire into, and it gives it basically a continuous electrical shock, very low grade, that just kind of confuses the signals going through that nerve to your brain. And he said you'd wear it for 2 months straight, and as much as possible, you'd wear this little device for about 2 months straight, and then disconnect it and see what happens. At that point, does medication work? Do you need to wear this thing longer, or what other options you have at the time? And that doesn't sound like a great option, to have this wire in my skin under here and hanging off my head. He says, yeah, you go to work, you do whatever, you just wear this little unit clipped on your shirt, I guess, or something, and you have this wire in your head. I don't want to do that. I hope I never have to do that, ever. But it is an option that I learned about, or that he told me about. There are some more extremely invasive options out there that I found out later on, as I was doing more research. Depending on, in my case, this nerve, where it comes up, there is a hole in the upper part of your eye socket and the skull. So the nerves come behind your eye, through this, up around your eye, through this hole, and spread out. So right here, where the nerve comes through the skull, there's a procedure if that nerve is being pinched by the skull. What they can do is they actually cut this open and expose your skull and your nerve, and they grind the bone away on the outside until they actually grind into that hole that your nerve is in and open it up, and then it relieves the pressure on the nerve. I hope I never have to have that, because it's extremely invasive. I will watch a surgery, and it's not something you'd want to have to do. It's kind of a last option before you're running out of options. But they can decompress that nerve, if that's what's causing the pain. For now, if I can do the RFA, the radio frequency ablation, and if I have to do that multiple times, then that's what I'll do. I'll take medication preferably before they are sticking a wire into my skin up through here, or having to actually cut this open and decompress the nerve. Those are two of the options outside of medications. I'm sure there's more, and they're always coming up with more. Those are just, at this moment, what I know, but just be aware that there are lots of options. They may not tell you that at the beginning, but there are lots of options to help handle and reduce or remove the pain, depending on your situation. Luckily for me, it's the RFA at this point is my best option, and just dealing with what leftover pain there is. Yeah, this experience, the last 5 months, has been extremely painful. Now that I've been through it, I got medications. I've got different options. Hopefully I can handle this from now on and on my own, and just go to my pain doctor and not have to go back to Cleveland. But if that's need be, then that's need be. So if you have this pain, don't give up. Keep searching. Find a doctor. Find the right location, hospitals, doctors, whatever you need, the medications. I suggest getting on many of the websites. There's many facial pain websites, and they talk about the trigeminal, they talk about other nerves, they talk about all kinds of things. And I'd also, if you're on Facebook, join the Facebook groups and talk to people, because that's what I did. I learned a lot. I also I think I helped some other people that we talked about, what does your pain feel like, and where's your pain, and this is what I did, this is the doctors I saw, this is the locations I went. Just join the community, learn about it, and try to help yourself, help somebody else. There's always new technologies coming out. So I'm hoping maybe in the future that they'll have something besides the RFA that they can do to help me, whether it's a new medication or different procedure, whatever it is. But I pretty much just have to live with this forever. I just have to just deal with it and do the best I can to reduce my pain. Well, thanks for watching. Check out the description I'll put all the medications I was on. I'll probably link Cleveland Clinic's website, some of these facial pain websites. I'll throw some of those in there just to help you do your research, learn about it if you have this problem or if you know somebody that has this problem, to help them. So check that out, and thank you for watching.